Hi, and welcome to the Animal Welfare Junction. This is your host, Dr. G, and our music is written and produced by Mike Sullivan. Today's guest is Vicki Deisner, Executive Director of Ohio Animal Advocates and past guest. So thank you for being here, Vicki. Welcome again to the Junction.
Thank you for having me, and it's good to see you again and
And
your audience.
thank you. Well, anybody that wants to learn more about you, you were a previous guest on an episode about Ohio Animal Advocates. So anybody that's interested in learning about the organization and such can definitely check that out. Today, we're going to be talking about some policy and legislation changes that we're looking for in Ohio that have a big impact on companion animals. So let's start with the first one, which is about a statewide ban on cat declawing. Can you tell us about that?
Yes, this is such an important bill, and certainly we would not be the first state to address it. A ban on cat declawing has been passed in many other states, and we are looking at doing that, supporting that effort, because indeed, when you declaw a cat, you basically cut off its first digits on every part of its paws. This is not painless. And it's also not always recoverable. There are many animals that suffer throughout their life, especially how the procedure was done, if they get an infection. And indeed, there are other ways to address the unintentional damage that can be done in a home by a cat that still has its claws.
Yeah, as a veterinarian, one of the behavioral issues that we see is that when you remove a cat's claws, they're more likely to bite. And they're also, because of the pain and discomfort that they go through this, they're more likely to have other behaviors like inappropriate urinations and defecations, right? So some of these cats may develop some really bad issues when, all it takes is figuring out how to trim their nails or use scratching posts and such.
And though this is the first year it's been introduced, and often it takes 5 to 7 years to get animal legislation passed, it is a surprise, you might say, at the lack of movement of this particular bill in the Ohio Statehouse at this time.
And it's not something that is unheard of, right? Because there are other states that have enacted declaw bans.
Absolutely. One thing we are surprised about, to be honest, is some of the opposition that has come up recently. And actually, from, you might say, people who we would believe would partner on this issue, and that's the Ohio Veterinary Medical Association. Their reason is that a ban would take the medical decisions away from the actual veterinarian. But indeed, people who do get this procedure done for their animals are generally not informed as to the potential side effects and consequences of doing this procedure. It has over time lost its attraction to many owners, you might say, who are aware of this, but the majority are not aware of what can happen to a cat, what the actual effects on the cat are. In fact, unfortunately, a lot of people think it's just like cutting their nails, and it's not that simple. It's cutting basically their paws, the end of their paws off. And we really wish this would be looked at further, and we certainly will keep pushing it year after year. But we are surprised about this particular opposition.
In past times, we've always thought about people thinking, I got a cat, I got to get it spayed or neutered and declawed, right? Like it just went hand in hand. And it's over time, we have learned, right? Back then, we didn't understand the long term effects, we didn't understand the issues. And it's something that is done more as a convenience, more so than for any real benefit for either side. And one of the things that I found out is because when I started working as a veterinarian, I used to declaw cats and I didn't like it, but I would do it. And I would look for, what's the best way that I can do it that would prevent discomfort and pain, a lot of pain medication, pain control, use of laser. And even with all of those things, I still saw that the long term suffering was just not okay for me from a moral and ethical standpoint. And when I stopped doing it, I thought a lot of people are going to be mad because, it's something that, again, people expect to do. And I was very happily surprised that it was not very difficult to change people's minds because the pet owner looks for the veterinarian for recommendations. So they would come in and say, I need to schedule to get my cat declawed. And we would talk to them and say, we don't recommend it, and this is why. And they would say, oh, I was not aware. And, it would take giving them resources like, again, cat scratching posts, how to trim nails, different things that can be done. And we did not find a huge opposition from the pet owners. And I'm very happy to say that it's very seldom that people ask us anymore if that's something that we do.
I assume that shows a trend of the time that the consumers are more educated,
Yeah,
the
absolutely.
clients.
Yeah, and that's our job as veterinarians, right? Is to educate the clients so that they can take better care of their pet. It's hard to think that a person would purposefully want to harm their cat, right? So it's all about education.
Out of curiosity, what happened with the clients that when you used to do it, and the after effects was the animal was hurting? Were the clients surprised? I'm sure you gave them as possible consequence that happening, but how did they feel afterwards?
So I think that we had very few issues and side effects, mostly because of everything that we were doing in the
Okay,
process, right? We were
good.
taking it as a very serious surgery, not just as an elective. We're just taking these claws out and removing. But I think that, we were very open and honest with the clients, explaining to them these are the possible things that can happen. So in reality, when there was a side effect or a problem, it was expected.
Thank you for
Yeah.
sharing that.
Yeah, I will have to say, one of the we did see patients from other clinics, and especially after we stopped doing it, that would come to us because the cats have developed some kind of problem, either pain, regrowth, inability to use the paw properly, and again the inappropriate urinations, and most of those people did not have that communication with the veterinarian about what to expect, and they were completely taken by surprise and upset about the fact that they did something to harm their cat that they were not aware that could be a potential consequence. So, so yeah, it just again goes along to that part of communication is so important between the veterinarian and the pet owner.
Absolutely.
One of the things that I also want to bring up is the fact that the concern for the opposition is that it takes away decisions from veterinarians. But in reality, it doesn't, because if a veterinarian feels that the declaw procedure is necessary for the health of that cat, they are allowed to do so. What we're talking about is not allowing declawing, again, just for convenience issues, because you don't want to trim your cat's nails so it doesn't, tear up your stuff. So if I, as a veterinarian, feel a great example that I can say is cats that have their dew claws, that have double dew claws, and those dew claws get grow into the pads. That's something that we do because it is giving a benefit to the cat. It is something that is necessary. So a law like this would not prevent me from doing something like that that is in the benefit of the cat.
And I will tell you that our grassroots advocates, the ones who work with community cats, with kittens, and just cats in general, this was the most important bill out of the session to them.
So we're going from not being able to declaw cats to now basically mutilating puppies. So how about you tell us about SB 232?
232 is a very important bill that you might say the folks that have worked on puppy mill issues in Ohio have worked toward for 15 years. And what that would do is basically eliminate the breeders from doing any surgeries. They have done it for years. There has been problems with animals dying from massive infections, from bleeding out, from you name it. It can be a very debauched surgery, but particularly when it's what they're doing is they're doing it for cosmetic purposes. They're doing tail docking, dew claw removal, and ear cropping. And particularly with the tail, um, you're cutting through bone, I don't need to tell you that, but you're cutting through bone, you're cutting through soft tissue, you're cutting through blood vessels. And I mean, it could really hurt the animal.
And just give them enough to hold on when they're bigger. And it's going to be quick. They're going to yelp. We're going to lay them on there, get them all done, then put them back in here and get mama in. I don't put any kind of antibiotic or anything on there. I want her to come in. I want her to lick them. If she's licking them, she's pulling that skin as she licks them. And then it'll heal. It makes a better tail. We've banded them before. It doesn't make a pretty tail. You've seen band slip. And when a band slips, it doesn't, it's not good. So, Dykes, alcohol wipes, 10 pups here, so I'll probably wipe it off halfway through, but it's going to go fast. You ready? Ready? If you're going to be a vet. So I'm going to hold it like this. And this is the way it's going to be for its life. So here we go. It's gone. This one's wiggly.
On top of it, if the breeders are doing it, they now are possibly allowed to use pain medication if they do, but they definitely aren't allowed to use anesthesia. And these procedures are supposed to be done within a certain time frame. Oftentimes they're done over that time frame, which means the puppy is going to incur more pain. We have an ongoing problem with this with the Ohio Department of Agriculture because the law as it was written in 2018 specifically stated that any euthanasia or surgery required to be performed had to be done by a veterinarian. The Ohio Department of Agriculture chose to define required as medically required. And then they decided to say anything cosmetic required didn't fall into that category, so the breeders could keep doing it. We believe this is because the breeders wanted to keep doing this, and ODA capitulated to the breeders. The reality is it doesn't benefit the animals. And the odd thing is, again, even though this was written, and this was part of also trying to assure that, this was a law to add additional restrictions, not allowing the Ohio Department of Agriculture to do announced inspections, because of course they're going to clean up their act before somebody shows up. And indeed, within that time frame, a lot of those breeders are basically, calling the rescues and saying, come and get these animals or we're going to kill them in 2 days because ODA is coming to inspect us. And also defining how, they are defined as a commercial dog breeder. I mean, if you say there's so many, intact female dogs that can reproduce, but then you add in a definition of you have to sell 40 puppies. There's a lot of breeders that do not make records, and you can't prove that. So we really need to clamp down on these three areas, but particularly the surgical. And oddly enough, then again, the opposition for this particular bill is again the Ohio Veterinary Medical Association, which has said that this requirement would actually burden rural communities and their clinics because access is very limited. But why you would ever allow, you're looking at breeders that hopefully they have a high school education at least, but you're allowing them to do surgeries when you require veterinarians to go through all the years they do of education and clinical experience to be doing these surgeries. It doesn't make sense. And I will throw in too, even though when we addressed this in 2022 and knew at the time, because there were pictures showing this, that surgical equipment oftentimes wasn't used. It could be hedge clippers, it could be a nail clippers, it could be, just even a slice of, a steel slice to cut through, you name it. But also there wasn't sterility in this, and there wasn't antibiotics given to the animals afterwards. But Ohio Department of Agriculture said they were going to give the breeders a how-to manual. We still know in 2026 that this is not being followed, the how-to manual. And so unfortunately, it isn't that the breeders have improved how they do the surgeries. It's totally unacceptable. And I would say, according to the advocates we have, again, the folks that care about the issues of puppy mills This is their most important bill they want to work on, and believe very strongly that this should not be happening. And yet, I think they would be surprised that the Ohio Veterinary Medical Association would not support this bill.
I think, in my opinion, it is the dumbest distinction to say that a surgery is no longer surgical if it is cosmetic, right? Because then all of these people that are doing botched plastic surgeries in strip malls, then they are not practicing medicine without a license because it's cosmetic. I mean, it makes no difference, right? It's if you're doing surgery, if you are cutting through skin, you're cutting through bone, you're doing a surgical procedure, it is surgery. This whole
Yes.
it's cosmetic is just like, I mean, we talk about the intent of the law, and this definition as far as trying to figure out what the intent of the law is just, I mean, I don't have any other better words. It's just the dumbest thing I've heard.
Yeah.
And,
And it wasn't defined that way within the law itself. That happens to be the convenient interpretation that the Ohio Department of Agriculture chooses.
and you know, when they discussed about giving them an instruction manual, it's like it doesn't matter if you give them an instruction manual because they're not able to get their hands on veterinary products, on veterinary supplies, right? So, okay, they cannot get their hands on any kind of local anesthetic, topical anesthetic that they can legally administer. They cannot get their hands in any kind of pain medication or antibiotics or anything that they can legally administer to a companion animal because they're not a veterinarian, and a veterinarian cannot just prescribe a medication or a product without having seen that pet, because that is what this VCPR that we're going to be discussing about, the veterinary patient client relationship, stipulates that a veterinarian has to have a relationship with the pet owner, which in this case would be the breeder, and have a relationship with the patient, which would be that individual dog. So, there is no way that a veterinarian can legally just say, yes, use this for your puppies when you're doing this procedure that you should not even be doing. And, it's most veterinarians that I know are opposed to this happening just because, again, it's a surgery procedure. And like you mentioned, we go through all this schooling and education and we learn all these things to be able to do surgery. And then you take somebody without an education and you give them something sharp and tell them that it's okay to mutilate these animals. So it just doesn't make any sense at all.
I would add, when you bring up the point that most veterinarians that you know would not agree to this, um, when I worked for the ASPCA, and we were trying to run a bill in Illinois that would allow veterinarians to get coverage, and be approved to come across states to deal with natural disasters of animals or man-made disasters, if it was big dog fighting rings or puppy mill issues, that the Illinois VMA was against it. And when actually talking to a number of the vets in Illinois to try to understand if they could explain to us, why is your VMA against it? They said they didn't know because they really weren't involved in the VMA. And in, questioning them further, and asking why, they said the cost of belonging to the VMA as a member was so high that they basically belonged every third year, maybe, to be able to get all their CEs done within that time frame, and that was it. They couldn't afford to belong every year. So when we then asked, well, then who sits on the VMA policy committees? Who sits on the leadership? They did not know, but further investigation showed that a lot of times veterinarians were able to do that, become more active, when maybe they worked for a commercial dog breeder that would basically pay for their full membership to the VMA and encourage their involvement in policy issues. The same way for factory farms or other issues. So it kind of points to, I began to wonder and still wonder, who really basically sets the leadership and policy decisions for the VMAs. It's certainly not the entire veterinarian community in that state.
Yeah, I think that, the OVMA, like if you go to their website, they have a lot of really useful resources for veterinarians, especially like for the mandatory reporting law and for different things. And it has a lot of really good information, but I don't know that a lot of veterinarians know how to access it. And again, I don't know that veterinarians necessarily have a voice into the things that the OVMA is representing on our behalf. And I mean, I have been a member of the Ohio Veterinary Medical Association since I graduated vet school, and it has expired here and there. And come conference time, it's like, oh yeah, I gotta renew that. But yeah, I think that as veterinarians, we have to be more aware of what the Veterinary Medical Association stands for. So because they're in essence representing us as members. And if they're not representing what the majority of veterinarians want, then it's not really representing veterinary medicine in Ohio.
And then actually they're not working on the change that is really need for the veterinarians in every aspect of trenches they're in, whether it's working with small animals, large animals, and the reality of everything that they encounter.
Now for House Bill 664, and this I have to say, I mean, I have been working on trying to elevate veterinary technicians for a really 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 long time because I think that they're underutilized. I think that a lot of veterinary technicians are leaving the field just because they're bored and they're not well paid, and these are individuals that go through school, get an associate's degree, like they have to do continuing education, they have to do so much to be called a registered veterinary technician. And to a sense they are the same as what we would expect a nurse to do. Actually, they do more than nurses do because they have to do so many different things for their patients, and they're just not given the ability to do all of these things. So one of the things is that as a mobile veterinarian, from primarily doing affordable and accessible care, I see the need for, in particularly in rural areas of Ohio, the need for more access to wellness care, to vaccinations, to be preventive, um, so that these individuals don't have access to veterinarians. So definitely, if their animals get sick, they're not going to be able to take them somewhere to be seen. But if we can prevent some of these diseases, I mean, that's a huge impact. So House Bill 664 is about allowing registered veterinary technicians to administer vaccines and antiparasitic medications to companion animals without a veterinarian present, but under the direction of a licensed veterinarian.
Um, Looking at House Bill 664, it would be nothing but a benefit from what many of the not only advocates, but the rescues, the humane shelters we talked to, um, animal welfare professionals, that they see the need for this because there's been a veterinarian shortage since before the pandemic. There's been a spay neuter shortage that's been going on over the last decade that is putting us back at the point of, numbers of homeless animals like there was a decade ago. When you don't get spay neuter, a lot of times, you're also not getting wellness care for the animals and you're not getting all the vaccines. And at a time in particular when Ohio, we do not have rabies vaccinations being required and mandated throughout the state, and yet we passed dangerous dog law because there's a concern about an increase in bites. Why aren't we having mandatory rabies vaccines? But we can't do it with the current vet shortage. So indeed, as you said, utilizing these people to do shots, which is not really that difficult. We can't move forward in this, you might say, minimal way, because certainly the RVTs could do a lot more under the direction of a veterinarian's care. It needs to happen. And the most astonishing thing is, again, once again, we have the Ohio Veterinary Medical Association opposing it, saying that basically, they believe the VCPR establishment should only be reserved for the veterinarian. But it was my understanding from what I heard from the vets that, the technicians would be doing it along with the approval and the oversight of the veterinarian. Maybe they're not right on site, but here's the strange thing: where you have the most trouble of getting the rabies vaccination is in the rural area. And didn't OVMA just say it was okay to do surgeries in the rural areas because there was an overburden on the clinics? but it's not okay to do rabies shots with a technician under the supervision of a veterinarian in a rural area? How could surgeries be okay and vaccinations are not? It makes no sense. It's just it's total opposite. It makes no sense. There's no other way to explain it. It's, you know, hypercritical.
And surgeries by lay people, right? Like not even surgeries by a registered veterinary technicians. We're talking about lay people doing surgeries, and we're asking for registered veterinary technicians to be able to give vaccinations. And registered veterinary technicians, you know, they go through a 2-year schooling, and veterinarians, we go through 4-year schooling. But our education is vastly different because we have to do more diagnosis and surgery and that kind of stuff, whereas the technicians are more, how do you say, educated into the wellness, into the examination, into how to identify abnormal things, and then we trust them to do anesthesia inductions and prepping and all of that stuff, which requires a lot of education and talent. So, you know, in my experience, in most veterinary clinics, veterinary technicians are doing the majority of the work with the patient. The technicians are the ones, you know, if a patient comes in and they have an ear infection, the tech is the one that goes into the room, talks to the owner. The owner says, my dog has been shaking its head. Before the veterinarian is even in the room, the technician has collected the sample, made the swab, analyzed it, and given the veterinarian the information about what they have found. So, you know, we trust them to do all these things, but then all of a sudden, just because of this hang up, we're saying that they're not allowed to give vaccines. But then you know, the switch is that now there was a change into how the legislation was proposed initially.
For its fourth hearing, and recognize Vice Chair Newman for a motion.
Thank you, Mr. Chairman. I motion to amend with 136_2820.
The amendment is in order. Will the member please explain the amendment?
Yes, sir. Will do. Thank you. This amendment defines covered animal to mean a sheltered dog or cat, thus limiting a registered veterinary technician to dispense and administer vaccines and antiparasitic medication to only shelter dogs and cats instead of all dogs and cats.
Are there any objections to the amendment? Hearing none, the amendment is accepted.
Initially, it was for technicians to be able to give vaccinations to any dog or cat, and then it got changed to they would only be allowed to do it to shelter dogs and cats, which there is no difference between the two. The only difference is ownership. But we're saying that legally, they are okay to give a vaccine to a dog that is not owned by an individual, but not okay to do it to a pet that is owned. That makes absolutely zero legal sense.
For its fourth hearing, and recognize Vice Chair Newman for a motion.
Thank you, Mr. Chairman. I motion to amend with 136_2820.
The amendment is in order. Will the member please explain the amendment?
Yes, sir. Will do. Thank you. This amendment defines covered animal to mean a sheltered dog or cat, thus limiting a registered veterinary technician to dispense and administer vaccines and antiparasitic medication to only shelter dogs and cats instead of all dogs and cats.
Are there any objections to the amendment? Hearing none, the amendment is accepted. With us today, Alba Gonzalez, to provide interested party testimony. Welcome to Ag Committee, and you can proceed when you're ready.
Thank you so much. All right. All right. Chair Klopfenstein, Vice Chair Newman, Ranking Minority Member Miller, and distinguished members of the House Agriculture Committee. My name is Michelle Gonzalez, and I'm a veterinarian licensed and practicing in the state of Ohio for the last 26 years. I am the founder and medical director of the Rascal Unit, which is a mobile veterinary clinic providing affordable and accessible care throughout the state of Ohio. And I'm also the director of Rascal Charities, which is a 501c3 nonprofit organization with a mission to assist individuals, shelters, and animal caretakers in an effort to reduce shelter overpopulation, preventable diseases, and economic euthanasia. I would like to thank Representatives Fisher and Dieter for their commitment to sponsoring this important legislation. And I'm speaking on behalf of myself and my organization. I'm here to support the House bill, but as originally introduced. 20 years ago, I started the Rascal Unit because I saw a need for services that provided veterinary care to individuals in need. And in doing so, I learned that most people want to take care of their animals. A lot of people are unable to, whether it be for access because they can't get to a veterinarian, or it can be because of affordability, or even just simply for a lack of education. So I felt that as a veterinarian, having the veterinary oath, it's my duty to make sure that all animals have access to care. 20 years later, that has not changed. So the reality that we face today is a shortage in access to veterinary care. And the House Bill 664, as originally presented, provides a solution because we're using registered veterinary technicians. And these are people who undergo schooling. They are licensed in the state of Ohio. And we would be asking them to provide preventive care under the direction, but without the direct supervision of a licensed veterinarian. So by allowing these RVTs to provide vaccinations and wellness care without the need of a veterinarian physically present, we aim to decrease the risk of preventable diseases and keep animals and people safer, as some of these conditions are transmitted from animals to humans. The new sub-bill fails to provide help to communities in need of pet wellness care. It's useful to some shelters, but the reality is that many shelter organizations already provide their own vaccines to their own animals. So it's not really going to increase access. The only exception is rabies vaccination, and currently less than half the counties in Ohio require rabies vaccination by law. So it's not something that shelters may necessarily use on their own. So the goal of access to care is increasing the resources to communities. And again, we are eliminating the ability to provide the service to pet owners. We're limiting the services to shelters, and by doing so, we do not have the opportunity to prevent deadly contagious diseases such as parvovirus, distemper, and rabies. The new bill seeks to allow veterinary technicians to administer rabies vaccination and others to shelter animals only and not to community animals. But the only difference between a shelter animal and an owned pet is just ownership. It's not productive to create a legal distinction based on ownership when all companion animals, owned and unowned, are considered the same. And this is not my definition. This is a definition by the Ohio Supreme Court. House Bill 664, as originally drafted, provides services to all companion animals by registered veterinary technicians under the direction of a veterinarian, following protocols established by the veterinarian to prevent technicians from acting independently and without guidance. This would be a great advancement in access to veterinary care in both animal and public health. So I respectfully urge you to support HB 664 in its original form, because all companion animals should have the opportunity to receive these services. Thank you for listening, and I'm happy to answer any questions.
Thank you for being here today and offering testimony. Are there any questions from the committee? Representative Brandt.
Thank you, Chairman. From the Chairman to the witness, thank you for coming and providing your testimony as a subject matter expert in this space. My question, though, is obviously there's been some interest party meeting to get us to this point where this amendment is going to be may or may not be, has been added at this point. Who do you feel like are the winners and the losers with adding on this new language, specifically name them by name?
Yeah, absolutely. I honestly don't think that there's a lot of winners. I think there's more losers, just because access to care is a huge problem. And I speak from personal experience because most of my work has been in rural Ohio. I travel through a lot of rural communities, especially Appalachia communities, where the access to care is limited by distance, but it's also limited by the number of veterinarians and by cost of care. So those are the animals that really need this service. And the shelters are affected, but the shelters are affected because if the community animals are not vaccinated, then those animals, when they enter the shelters, then they're going to be transmitting these diseases to the animals in the shelter. So it's beneficial to the shelters and to communities for the community animals to be vaccinated.
Follow up.
Follow up?
Thank you, Chairman. So why do you think this amendment was even included out of everything? We've gotten to this point, and this bill it's been around long enough, but what do you think was the motivation?
In my opinion, honestly, I think that it was due to appease the Ohio Veterinary Medical Association, because I understand that they oppose companion animals that are owned being vaccinated by technicians, but they are okay, or at least neutral, with shelter animals being vaccinated by technicians. And realistically, the whole question behind the rabies vaccination is a legal one. So if a technician is legally allowed to vaccinate a shelter animal, why would they not be legally allowed to vaccinate an owned animal? If we're thinking about the fact that if the technician vaccinates the animal at the shelter and then that animal is adopted out, then that animal becomes owned and still has been vaccinated by a veterinary technician.
So, Chairman, just for clarification, the witness is more or less trying to make sure that all animals get vaccinated? I'm saying it just for her, but I have to say it to you, protocol.
Yes,
Okay,
sorry.
thank you. Thank you, Chairman.
Any additional questions? So, having listened to your testimony, you like the direction the bill is headed, but your thought is it does not go far enough.
Yeah, absolutely. For us to make an impact, we need to make it accessible to the majority of animals, not limited to shelter animals, especially when, again, shelters have a little bit more access to care compared to the community.
Okay. Any additional questions? Representative Sims.
Thank you, Mr. Chairman. So are you still IP or are you an opponent?
Well, I don't want to be an opponent. I've been wanting technicians to be elevated for a really long time. And I am biased because I have amazing technicians that work for me. So, and I know that I would trust them to make decisions with their education and with their experience. So I don't want to oppose because I don't want it to go backwards, but I am not in agreement the way that it is, I guess. So that's why I present it as an interested party. This is something that is extremely important to me. I don't want it to just go away, but I feel that if it's going to go forward, it needs to go forward the right way.
Follow up?
So, based on your expert opinion, does this halt really expanding access to care for animals?
If we're only doing it for shelters, it is not expanding access to care for animals, in my opinion.
Thank you, Mr. Chairman.
That was one of the things that I was discussing is this is an access to care bill. So we are looking to provide access to vaccination to the majority of dogs and cats. And by making it only be to the shelters, first, you have a huge population that would not be able to benefit from this. But second, most shelters have some form of access to vaccinations, whether it be general vaccinations and sometimes rabies through veterinarians that come and visit the shelter. So are we increasing access to care? We're not, because we're just basically giving someone something that they already have, while those who don't have it are still unable to get it.
It's tragedy. It's not improving the care of animals across the board. It definitely is not.
And we think about in human medicine, right? Nurse practitioners can establish these relationships with human patients and be able to do certain things. And we have the registered veterinary technicians that are trained and educated that we are saying that they're not allowed to do this. And one of the things that scares me is that we have this veterinary practitioner degree now, that this master's degree that is occurring currently in Colorado, which allows individuals that are not RVTs and are not veterinarians to do more things than what technicians are allowed to do. I mean, we're even talking about allowing these people to do surgeries. And we have to be very careful because I personally don't think that that position is a benefit to animals. I think that it is a very dangerous road that we're going under. And if it keeps growing, it's going to come to Ohio. So, what better way to provide a service by using registered veterinary technicians as opposed to bringing in these individuals with a master's degree that, in my opinion, should not be allowed to do any of these things without a veterinarian present.
It doesn't make sense. I mean, it seems OVMA is taking a position on one hand that's totally opposite from the position they are taking on the other bill. So, but none of it is helpful to the vast majority of Ohioans that are hurting regarding having access to veterinarian care. They're hurting because their animals are hurting. They're not getting the care that they need.
Yeah, and you know, bringing everything kind of together as well. Recently, we passed the telemedicine, which allows a veterinarian to establish a VCPR over the phone. So a veterinarian is able to assess a patient over a Zoom call where the pet owner doesn't know necessarily what they're looking for, what they're feeling. They can't listen to them. They can't listen to their heart or anything like that to make a determination of their pet's health. Yet a veterinarian can prescribe products based on this Zoom call, and a technician who is trained to do examinations and do all of these things. Again, we're not trusting them to create this relationship that is created otherwise through a Zoom call. So there's just a huge disconnect. And my fear is that a lot of this is just financial, that a lot of this is just because of money. It's kind of, we're talking about the inability for the technicians to do these things, and we want the veterinarian to be the one to do it, and it just makes it too much profit over welfare, right? It just comes down to, what are we talking about here? Are we really doing this because we care about the health of the animal and the safety of the animal, or are we doing it just to protect somebody's investment? Because it we're saying that we rather have a dog go without a vaccine than have a technician give the vaccine, right? So is that really quality of care? Is that really promoting welfare and well-being? In my
No,
opinion, it's not.
no. We need to do better for our animals in Ohio.
So
And we'll keep pushing for the passage of these bills every year till we get this done. It's needed, and there's no excuse not to improve the quality of care for the animals, regardless of, you might say, OVMA's position. We know better.
if the members of the public that maybe may feel strongly about these bills and they want to be heard, what are ways that they can help support so that we can get these common sense animal welfare laws passed?
Thank you for asking that. Actually, if folks will go to ohioanimaladvocates.org and sign up for our newsletters, which not only would you get monthly newsletters, but you would be able to get updates on a variety of bills that are going out. And in fact, we have Congress Plus now that will send people information on action alerts on bills that are really moving and we need help. Because the reality is we need the grassroots advocacy to get these passed. We need every Ohioan in every county and every district to basically let their legislators know that this is important to them. It's important to their family. It's important. Their animals are their family. And we need to get these bills moved and we need to get that message across. And so we would encourage people to do that and get active with us on the type of legislation that matters to them and their animals at home.
And Ohio Animal Advocates is a nonprofit organization, so donations are always, important. So if somebody wants to give a donation, how can they get information on that?
Actually, if they get on the newsletters, it'll say donate at the bottom, but all they have to do is actually go to the website and hit a donation button. They can actually, look up our info at Ohio Animal Advocates to ask more questions if they have any problems, or give me a call. My number's on there, and we can tell people about what their donation would mean. But every donation is important, from, a dollar to $100. It doesn't matter. This makes a difference. This enables us to reach everybody across the state and keep them informed about important legislation, as we've talked about today, and how they can make a difference and get it passed at the State House.
And another way that people can follow Ohio Animal Advocates is on social media. So on Facebook, Instagram, and all of the platforms. There's a lot of
LinkedIn,
updates. Yes, a lot of
yes.
updates on there so that people can see what we're working on and what they can do to help out.
Absolutely. And I would also point out that besides the legislation that we work on and to get passed, we work on programs. For example, every year we do community cat summits in northern and southern Ohio, where people can come, and interact with people doing this work within their regions. We also have statewide resources where we list in every county pet food pantries, low-cost spay-neuter and TNR, where to report cruelty, safe havens to put animals in to get them out of domestic violence, wildlife rehabbers, and companion animal vets across the state. We continue to evolve and grow our organization to meet the needs of pet owners and Ohioans that care about other, animals that are not companion animals, such as wildlife and farm animals. We keep growing to meet the needs of Ohioans and their positions and their feelings about the animals that reside in our state.
Excellent. So everybody listening, ohioanimaladvocates.org, you can click on that, like look through the site, learn about all the amazing things that are happening. And aside from that, thank you very much, Vicki, for being here and for talking about this really important legislation with us.
It's very important legislation. Please all get involved, because it will make a difference. You can make a difference, and that's what's really important to know. Contacting your legislature on a statewide basis really does matter. They're here to represent you. You are their constituent.
Excellent. Well, thank you very much for being here. And for everybody listening, thank you for listening and thank you for caring.